The more you are clean, the more there is allergy. We are looking at the hygiene hypothesis because it provides a vital framework for understanding the global allergy epidemic, where rates of atopic dermatitis, asthma, and food allergies have skyrocketed in industrialized nations. David P. Strachan proposed the hygiene hypothesis in 1989 to explain a puzzling trend he observed while studying hay fever and eczema in British children. It suggests that early contact with microbes trains the immune system to distinguish between harmful and harmless substances. Specifically for atopic dermatitis, eczema, the hypothesis operates through these mechanisms. The Th1 and Th2 imbalance. The immune system has two primary response arms. The Th1, which handles infections, and Th2, which handles allergic responses. Without enough practice fighting infections, for cells of Th1, the immune system remains skewed toward an overactive Th2 response, leading to allergic inflammation. Immune education. Frequent contact with environmental microbes and old friends microorganisms, with whom humans co-evolved with, is necessary for the immune system to develop regulatory T cells. These cells act as a control system to prevent the body from overreacting to harmless triggers, like pet dander or dust. Environmental factors. Modern lifestyle changes such as smaller family sizes, increased use of antibiotics, and living in sterile urban environments have significantly reduced this critical early microbial stimulation. Sibling effect. Observations that children with more older siblings, who bring home infections, often have a lower risk of eczema, supporting the idea that early germ exposure builds immunity. It is important to note that the hygiene hypothesis does not advocate for unhygienic conditions, but highlights the importance of environmental interaction for immune development.